What has the World Health Organization learned, Margaret, from the way it reacted?
Certainly, we've learned that the world still has to understand that this is humanity versus the virus. There are hopeful signs. The scientists worked that out from the beginning and have worked together very well. Politically, we as humans have not applied that lesson. We have used the politics to divide us rather than bring us together. And 2022 really needs to be the year we come together against this.
Dr. Tedros has asked that 70% of the world's population should be vaccinated by the middle of 2022. Is that achievable?
It certainly is. And what he was talking about was 70% in every country. Because actually, if you do the numbers, the rich countries, the wealthy, well-resourced countries have vaccinated such vast numbers of people, we could technically be at 70% quickly, but we want 70% of every country. And the reason we're saying that is if you do that, especially if you focus on the system we put out even before we had vaccinations, and that is getting the most vulnerable people 100% vaccinated. And that's people over 65, that's healthcare workers, and that's people with underlying conditions.
What are the figures telling you, Margaret, about immunity levels? Because there seems to be some figures suggesting there are waning immunity levels that could lead to more deaths.
So immunity is pretty complex. One element of it is something called neutralizing antibodies, which are produced by your B cells and are laser specific for particular parts of the virus. Now, they do drop. They don't drop hugely, but they drop, and they're less responsive to different variants. But you've got a backup, and that's your T cell system. Now, they're not as laser specific, but they're really good at crushing the virus once it's tried to set up a colony somewhere.
The Independent Allocation of Vaccines Group, the IAVG, recently revealed they'd only been able to validate less than, I think, 10% of the estimated 8 billion doses of vaccine which have been administered around the world. What's happened there? Do we know how many vaccines are potentially going to waste?
So vaccines will go to waste in every country. We're seeing this in wealthy countries and in poorer countries, middle countries. Where you see most wastage is where you've not been able to plan effectively in reasonable time, but also if you've received vaccines with a very short shelf life. We sadly saw a tragedy in Nigeria, for instance, because they had been donated vaccines, but with a very, very short shelf life. And they ended up having to destroy those vaccines because they did not have the planning and the populations in place to be able to vaccinate in the time left. And we've been asking the manufacturers, the donating countries, to let us know as early as possible so that we can bring it through the COVAX system, advise countries at what they're getting so they can organize to get those vaccines out to where they're needed and get the people who need them ready and get the staff ready to give them so it can all happen as quickly as possible.
We focused almost entirely on the pandemic, quite rightly, but there have been side effects from this pandemic and side effects from the lockdowns, certainly an increase in assaults and violence at home, especially against women in the home during lockdowns. And also, we've seen cancer patients having to delay their operations. How do you see the world recovering and the world's medical authorities recovering from these kind of terrible side effects from COVID?
These are really, really important issues you raise. So you get this massive pressure on mental health, on social interactions, just brought on not only by lockdowns, but by uncertainty, by job losses, by people who normally don't spend so much time together, not coping well with being together. And indeed, it's often women and children who are at the receiving end of that kind of suffering. And you are so right, cancer patients have had delayed diagnosis, been unable to get treatment. Women have had to give birth alone, not able to have their partners in support. And children, they're not getting vaccinated. All the normal routine vaccination services have seen big dips in many, many countries. So we've got an enormous amount of work to do to really strengthen our health systems, really understand that it's not a luxury. Health isn't a luxury. It's a basic necessity of society, and we all have to put as much support, as much financial support, as much societal support, and recognize that this is a global good. This is a good for every human being on the planet to have a strong health system wherever you are.
Lastly, do you think we're past the worst?
If we all make behavioural changes, we will make it much harder for this virus to find bodies to jump into. And we have vaccines. And I really do believe we've got a greater understanding worldwide that we've got to do this together. So yes, I do believe in 2022, we're going to get ahead of it.
Margaret Harris from the World Health Organization, many thanks to you for talking to us here on The Agenda.
It's a great pleasure speaking with you.